Hello, today I am going to discuss about various types of diabetes. It's important to know the types of diabetes in order to decide on correct treatment to be given to the patient. We know that the commonest form of diabetes that we encounter is type 2 diabetes. Nearly more than 80% of patients of diabetes that we see are of type 2 diabetes. Type 2 diabetes, we know that it was known as the diabetes of 40s and 50s. It's unfortunate that it is happening in a lower age group nowadays with other lifestyle diseases. Type 2 diabetes, we know that it's not about scarcity of insulin or paucity of insulin, but it's about improper action of insulin in the body. We know that there is something known as insulin resistance. In Indian diabetics, we are genetically peculiar set of patients, South Asians and in general and Indians in particular. We know that we have immense insulin resistance. What do we mean by insulin resistance? Even when there is an abundance of insulin, the insulin doesn't work properly due to internal obesity or internal adiposity or a lot of fat which is saturated, which is accumulated around the internal organs. This results in a lot of insulin resistance. This creates difficulties for the action of insulin even when there is abundance of insulin. So that is a challenge in type 2 diabetes. We know that there is hyperinsulinism sometimes. Even then there is diabetes. That is, there is the metabolism of glucose that we take in doesn't happen properly. So we are known as the thin fat Indians. That is, if we compare ourselves with a Westerner, we may be thin in terms of weight, in terms of BMI, but in terms of internal adiposity or the internal stored fat, we are still fat. So we are known as the thin fat Indian. And this results in type 2 diabetes. So type 2 diabetes, it is not about scarcity of insulin, but it is about the improper action or improper execution of the functions of insulin in the body. So that is the major type of diabetes we are concerned about, and so lifestyle modifications play a very important role in type 2 diabetes. Now we come to a second type of diabetes that is known as type 1 diabetes. Type 1 diabetes we know is due to an absolute shortage of insulin. We know that type 1 diabetes happens in a younger lot. That is, the youngest patient I have seen with type 1 diabetes is of the age of 3 months. So we can have it as early, and sometimes the type 1 diabetes runs into the age group of 19 to 20. Their peculiarity is that they don't have insulin at all. The pancreatic cells, the beta cells which produce insulin are totally gone. Those cells are totally annihilated by some process, and so they have to be treated with insulin and insulin alone, and the treatment goes on lifelong. As I talked about type 2 diabetes, that is the diabetes of adults or the common form of diabetes. Now we think that it is the attention has shifted from pancreas to the liver. The whole problem is initiated in the liver. There is excess adiposity or excess storage of fat in the liver, which gives rise to insulin resistance, and that eventually results in diabetes. So now liver is considered the key player in the pathogenesis of type 2 diabetes. Now coming to another type of diabetes, that is MODY, that is MODY, that is maturity onset diabetes in young, which is a genetically mediated form of diabetes. You have one person from each generation being a diabetic. The onset of diabetes is around 20 to 30 years, and they resemble the type 2 diabetes, but the treatment may vary a little and they are easier to handle. So that is about MODY, and then there is a type of diabetes which is known as LADA, LADA, that is latent autoimmune diabetes in adults. So this is a form of diabetes where autoantibodies are secreted against the beta cells of pancreas. That is, autoimmunity means that the immunity, which is usually protective for an individual, turns around his own or his own cells. So the immunity generally is known to protect us against the attack of microorganisms which are recognized as foreign. But in autoimmunity, what happens is our own cells, our own body parts are recognized as foreign, and there is an immunity which is acts against these our own cells. So that is how LADA is defined. That is, it is the latent autoimmune. Autoimmune means the antibodies being secreted against our own beta cells which secrete insulin. The next important type of diabetes is diabetes that arises from the pancreas, the stones and inflammation in the pancreas. There is an entity called chronic calcific pancreatitis. Chronic means it's a long-term process. Calcific means there are a lot of calculi that are formed in the pancreas, and that gives rise to pancreatitis, that is inflammation or improper functioning of pancreas. That results in two problems. One is the endocrine part, that is the hormonal part which secretes insulin, is jeopardized, and along with the another part of pancreas which secretes the enzymes for digestion, even that is affected. So this is like is called as chronic calcific pancreatitis, which leads to diabetes secondarily. And this is a very important form of diabetes. We see quite a few patients, and the concern is that you not only have to address the diabetes part, you have to address the part of the digestive system also, because the digestive juices that are supposed to be secreted from pancreas are in shortage in these kind of people. So these are the various types of, there are innumerable other types of diabetes, but these are a few of the types which are of concern for a clinical practitioner. So in certain age groups, like from 19 to 30, there is always a dilemma. What are we dealing with? In those cases, we need to do a couple of special tests just to know whether it's type 1 diabetes, type 2 diabetes, or other genetically mediated or genetically determined forms of diabetes. So that's about types of diabetes. Hope you liked the video. Thank you.